Not all questions are meant to be asked, but to find ones that cannot stay ignored. This is Answer Gear.
Have you ever popped a painkiller and wondered, how does it know where the pain is? Like, does it have some kind of built-in GPS? Is it scanning your body for distress signals? Or is it just blindly wandering through your system, hoping to stumble across the problem? Well, spoiler alert, painkillers don't actually know anything, but they do work in a surprisingly clever way. Let's break it down. The short answer, it's not a smart drug, but it works. Painkillers don't pinpoint pain like some kind of heat-seeking missile. Instead, they enter your bloodstream and go everywhere. The moment you swallow a pill, it dissolves in your stomach and gets absorbed into your bloodstream. From there, it circulates throughout your entire body, not just the area that hurts. But here's the trick. Painkillers don't need to know where the pain is because your body already does. So instead of targeting pain directly, painkillers block pain signals from reaching your brain, meaning your brain never even gets the memo that something hurts. How painkillers actually work, the science behind it. Pain happens when your body releases chemicals called prostaglandins. These little guys are like the emergency response team. They rush to the site of injury or inflammation, making nerves more sensitive and sending pain signals to your brain. Painkillers like ibuprofen, aspirin, or acetaminophen interrupt this process. NSAIDs, like ibuprofen and aspirin, block the enzyme that makes prostaglandins. Less prostaglandins, less pain signals. Acetaminophen, Tylenol, works differently. It doesn't stop prostaglandins as much, but it blocks pain signals in the brain itself. Opioids, like morphine and oxycodone, go straight to the brain and spinal cord, shutting down pain messages completely. So yeah, painkillers don't find pain. They just turn off the alarm system that tells your brain it's there. But why do painkillers work faster on some pains than others? Ever noticed that painkillers seem to kick in faster for a headache than, say, a twisted ankle? That's not your imagination. Blood flow matters. Areas with more blood flow, like your head, absorb painkillers faster. Type of pain matters. Pain from inflammation, like a sprain, needs NSAIDs. Nerve pain? Those don't work as well. Dosage and timing. Taking meds on an empty stomach speeds up absorption, but too much at once can be risky. So the reason your headache goes away in 20 minutes but your sore back still hurts an hour later, it's all about how the painkiller interacts with your body. Can you build a tolerance to painkillers, and why that's a problem? If you take painkillers regularly, you might notice they don't seem to work as well over time. That's because your body can build up a tolerance, meaning you need a higher dose to get the same effect. With NSAIDs and acetaminophen, tolerance isn't a huge issue, but long-term use can lead to liver or kidney damage. With opioids, tolerance builds fast, leading to a dangerous cycle where people take more and more, sometimes leading to addiction. Some painkillers even cause rebound pain, meaning stopping them makes the pain worse than before. So while painkillers are great for temporary relief, relying on them too much can backfire, literally making pain harder to manage in the long run. Final thoughts, the mind-blowing part about painkillers. So painkillers don't actually know where your pain is. They just block the signals, tricking your brain into thinking everything's fine. They're not targeting the pain. You are by taking them. Your brain is still in control, it's just being fed different information. And the best part? Sometimes just believing they'll work makes them more effective. Hello, placebo effect. So next time you take a painkiller, remember, it's not hunting down your pain. It's just flipping the off switch on your body's alarm system. Pretty wild, right? And hey, if you learned something new today, make sure to like this video, subscribe for more answers to the internet's weirdest questions, and drop a comment if you have a question you want answered next. That's the deal.